Okay, I am with Dr. Nicola Hardman for the next video in our Q&As for the VICTA Virtual Science Fair. Thank you very much for joining us. So you can tell us all about your role as a microbiologist. I suppose without further ado, could you tell us a little bit more about who you are and what you do?
Yep, no problem. Thank you, Luke, and thanks for inviting me. So, yeah, my name is Nicola. I'm a doctor. I'm a medical doctor, but I specialise in infection, and we've got a fancy title of medical microbiologist. But basically, my job is it's everything to do with infection, and obviously, I'm sure we'll talk a lot more about it during the interview. But every single day, managing infections, investigating infections.
I suppose the question is why? Why that area of science in particular?
Why that? So, yeah, it just interested me, and I think that's for me that's really key. It's got, it had to be something that got my interest and hooked me in. So the job is very varied, but what I really love about it is you're like a detective. So at the end of it, you've got a patient that you want to help, and there's obviously at the minute there's COVID going off, and we've seen how important infection is and managing infection. But really, I'm a detective. I'm solving puzzles and clues along the way. And that keeps my mind active. That's what I enjoy doing. So right from it took me a while to find medical microbiology. It's not, you don't hear about it every day, but once I came across it, I thought, wow, that's exactly me. It's just puzzles about infection, and they're the two things I like: solving puzzles and getting to grips with that kind of really sometimes gruesome infections. A lot of them, it's very straightforward, but yeah, it's fun, it's interesting, and every single day is different.
So you say every day is different. What might an average day or week look like for you in your role?
So it is different. We do have a rough template of what it's not. So for example, for me, I need to have a rough idea of what's happening. I can't just kind of go in and have no concept. So we have days which are called on-call days, and those days we're the microbiologist, the infection doctor, on duty, and queries about complicated infections come into us, usually by the telephone. And another interesting thing about our job is actually most of the people we deal with are other doctors. So rather than walking around the wards and speaking with patients and examining patients, my job now is getting queries and questions and problem solving for other doctors who are perhaps more generalists but have a patient with an infection. We do ward rounds, so we do still have that patient interaction, which I love, but we are so specialized now that it is just infection all the time. So we will take queries from other doctors. It could, one telephone call might be, that a baby's come in unwell and they're thinking that they've got meningitis, and what test do they do and what antibiotics do they give? And then the next question might be that there's been a few patients on an area that have all got COVID. What do they do? Where should they place those patients? So every single question is infection themed, but they can have lots of different nuances to it, and can talk about adults and children, surgery and non-surgical problems. So that's when we're on call. We also, every time you send a sample to a lab, so if you've ever done, ever had a throat swab done to yourself or ever had to send a urine sample, it will go to a microbiology lab, and there'll be a scientist in that lab that processes that sample. And the scientists are incredibly skilled in translating what is in your sample into, what is actually causing you the problem, really nailing down what organism, what bug is in there. And once they've done that, that information comes to me, and my job then is the interpretation of what does that bug in that sample mean to that person, and what do we do about it to make them better. So there's interpreting data, interpreting results from the lab, there's taking questions from doctors on the wards, and also dealing with, you know, infection control issues. So like I said, if we have lots of COVIDs in one area, what might we need to do to make sure those patients and other patients are safe? So that's an on-call day. But we have other duties as well. So you know, how does a doctor know which antibiotic to give to their patient? Well, a lot of the guidelines are written by medical microbiologists. So a part of my job is looking at the results that come out of our lab, looking at national guidance and producing guidelines that are relevant to our local population. And another element of my job is infection control, and at the moment I'm involved in planning a design and build of a hospital. So you wouldn't believe it, but actually a hospital build, there needs to be thought about infection in there. And again, I suppose COVID has brought this to light. So, you know, you hear all about, you know, the space, faith, and, you know, and also ventilation. So we need to make sure that when we build these hospitals, there is enough space for people and that there is the correct ventilation. So, but even things, you know, like flooring, you know, an infection doctor will advise on, well, you know, it needs to be a certain type of flooring in order for such and such a cleaning. So it is incredibly varied, because I can be having one conversation about a baby coming into hospital and what we're going to do to treat that baby, and then the next time I pick up the phone, I could be asked, well, what type of sink do we want in this area?
Yeah,
So,
not many
yeah.
jobs that go from, say, like you say, like urine samples to building hospitals. So
Yes, yeah. So it's always got that underlying infection theme, but it can take me off in so many different directions in any given day. And we do, you know, my day is largely 9 to 5, but people get infections, you know, overnight. So we do what, you know, out of hours work as well, where again it's usually that we'll get a telephone call and be asked to give advice.
And we, as part of the Q&As that we've done, we've spoken to a medical student who's halfway through her 6-year medical degree. And it's not like a lot of other degrees where you can kind of go into it with perhaps not looking to go into that as a career, but with a medical degree, that's very much going to be your focus and your ambitions. When you went through that process, was that you saying that microbiology kind of found that along the way? So I'm assuming that wasn't the first thing that you thought about when you went on your sort of medical training and your work.
No, and I kind of smiled back then, because it was there all along in what I was choosing to do, but I didn't realise this specialty really existed until much later on. So through school, you know, GCSEs, A levels, I'd always gone for, you know, I always wanted to understand things. I always asked questions. I wanted to kind of have the evidence and know the truth, and that kind of, you know, that's why I got into, you know, science subjects and then wanting to do medicine. And during the medical training, I was always drawn more towards infection modules. So if you had a lecture on infection, I'd be really keen.
Yeah.
And if we're in medical school, we were able to choose some of our own modules, or you could choose the title of certain essays or projects. And I was choosing infection or immunity type projects. And it was only later on that I kind of looked back and reflected and thought, actually, there's a bit of a trend here. And I started looking into infection specialties, but still wasn't really sure. And it was when I did my first job after medical school. You do 2 years, everybody does 2 years on the wards, doing a variety of specialties. And the first one I did was respiratory, so, you know, chest medicine essentially. And it was when there was the swine flu outbreak.
Yeah.
And we were getting lots of telephone calls from the microbiologists and virologists, and they were coming onto the ward and telling us what to do. And I thought, their job is amazing, this is so interesting. And I basically turned around to them and said, how did you get into what you're doing? Can I come and spend some time with you? and they all seem really happy in their job as well, which was a good thing. So I thought, actually, I'm interested in what they're doing, and they seem to be really loving what they're doing, and that's how I got into it. So within medicine, there are so many specialties and subspecialties within. So like your medical student will be being exposed to all number as she's going through her training, but actually even after your training, you'll get little kind of avenues that you can go off. And it is really interesting, and people sometimes change their route halfway through. You know, that is possible. I was lucky, I found it fairly early on.
And I think that leads nicely into my sort of final question, because a lot of people watching this will be either finishing their GCSEs or A levels and thinking about what they would like to do in the future. What might be your advice to any young person looking to do something similar?
Yeah, so choose something that you enjoy. Don't, you've got to have the interest, because there will be tough days and if you've got that, passion and drive for it, that will get you through. So choose things that you enjoy. You've also got to be realistic as well. So if you want to do medicine or a science degree, there will be some elements in that, when you apply to university, that you will actually have to have certain A levels to get into that course. So, make sure that you're, whilst you're thinking, right, oh, I really love this and I really love that, make sure as well that you are being realistic and check that if you want to apply to medicine, you're doing the right subjects. And then I think it just, for me, it just slotted in. So for example, I didn't choose all sciences at A levels. I had a mixture of sciences and arts, because that's what I enjoyed. And I thought, if I enjoy these now, then surely a course and a career that fits with this will be something that I enjoy. So stay true to yourself, choose subjects that you like. Along the line, make sure that it tallies up with the courses that you are anticipating in the future, and just go for it. You can, the limitation is only, often I find that it's usually me that limits myself. So just go for it and enjoy it. And the medicine science subjects are fantastic. There's so much history behind them, but every day there's the opportunity to find something new as well. So this kind of world that I'm working in and living in is fantastic.
Well, I think that's a really good note to end on. So thank you very much for giving your time to our science fair.
No problem. Thank you. Thanks for inviting me, and I hope everybody enjoys the fair.